Hello everyone, I'm Dr. Motahare, clinical and surgical pathologist, and welcome to this video about what happened to your biopsy, the journey of tissue sample. Today, we will follow your tissue sample from the moment it's collected to when the final report reaches your doctor. Let's dive in. The first step is tissue collection. Your doctor may use a needle, such as for thyroid, lymph nodes, sometimes breast tissue, and many others, or a kind of endoscope like colonoscopy or endoscopy, or just do surgery to obtain the tissue. Once it's collected, it's placed in the container which contains formalin. Formalin preserves the tissue. It's very important. If the tissue is placed in a container with water, it will be completely destroyed. Accurate labeling is very important to ensure that the sample is matched correctly with your records. After the collection, the sample should be sent to pathology lab. This process, transportation, is also important to take care of the sample. The lid should be so firm. If it leaks and the tissue remain without formalin, it will be degenerated. So transportation is also important. When we first receive the sample, actually we wait for around 2 hours and more in order to tissue be fixed. It depends on the size of the specimen. The small tissues are fixed fast, but the bigger one may need some time. After that, we have a small thing like operating room in the lab that the pathologist wear complete PPE and go there, do some gross examination. It means that we are looking to the tissue size, shape, visible abnormalities, and also based on the tissue type, we will do some kind of sections inside the tissue if needed, and also then select which areas are suspected, and then take small small samples from that size. This is called gross examination, and it's very important, actually as important as what we see under the microscope. Next, the tissue will go through processing and embedding. It's dehydrated and embedded in paraffin wax to create a solid box. Tissues typically spend around 12 hours in tissue processor before embedding. But this can be vary based on tissue thickness and also other factors. The processor removes the water from the cells gradually and then fill it with paraffin. Replace it with paraffin wax. Why? Because we want to section this tissue. We should cut this tissue into 5 micrometers thickness. We should make it solid in order to be cut. This block that we are processed is a formalin block, and we can then section it and use that section for staining the other part of preparing slides. Then one of the most important part that lots of the time we have problem in this section, it's staining. Actually, it's based on the previous steps. The tissue should be well prepared in order to be well stained. Staining highlights the cellular details, cytoplasm, nucleus, the tissue architecture, inflammatory cells, different things. The hematoxylin eosin or H&E staining is the standard method. It usually takes around 12 to 20 minutes. If it's needed, we will add another special stains. For example, we are looking for iron in the tissue, we will add some other stains. We are looking for collagen and other stains. Based on what we are expecting, but what we are thinking in our mind, we can add other stainings too. And finally, we will have the slides to see under the microscope. We can see one tissue sample here. We should look for different signs. It's normal or not. If there is inflammation or not. This is benign or not. If this is malignant, which category it is in. If it is benign, which benign disorder. For example, just for one breast tissue, we have lots of benign problems and lots of malignant ones. We should first identify the category and then subclassify to special entity. And you just imagine that we should know all of these information for all body, plus clinical pathology that we should know all. So the detailed study allow the doctor to make accurate diagnosis and determine patients' treatments, prognosis, and also everything. Sometimes for definite diagnosis, we need to do some special staining, which is called immunohistochemistry, IHC studies. IHC study is a special staining technique that detects special proteins in tissue samples by using antibodies that bind to that proteins. It's very important. IHC helps pathologists identify the type of the cells present and their behavior. They are very important in pathology. Maybe we have some poorly differentiated cells. We cannot identify the origin by the shape. We will use IHC study. We'll look for a special protein that are present, for example, in lung tissue, and a special protein that is present in breast tissue. We will stain for both of them and then look for evidence that this tissue is from breast or from lung, for example, in a metastatic tissue sample. Okay. Also, sometimes IHC is needed for targeted therapy, like for breast, we have ER/PR HER2. The treatment plan is completely different if the ER/PR HER2 are positive or negative. They are needed for targeted therapy in many different cancers. And also, it's very important for prognostic approaches about the tumor aggressiveness. Sometimes some proteins, the expression of some proteins in some cancers will guide us through a bad prognosis. And sometimes reverse. If we find some special marker in a tissue, in a sample, in a malignancy, it means that the patients will have better prognosis. This is very important. And also, when we are, for example, we have a tissue that is involved by a tumor that we don't know what is that tumor because the morphologic findings are not clear. Just imagine that, for example, breast tissue has a special morphology, lung tissue has special morphology under the microscope. Every part of the body has its own special shape in normal shape. But when it turns to malignancy, cells just lose their original shape. And as much as they are differentiated, as much as they are immature, they are not the same as the original one, it will be harder to find out the origin just by shape. When we add IHC, we can solve this problem by looking for special proteins that are used in that tissue. Finally, the pathologist write a report, summarize all findings, and give a definite diagnosis and sometimes a differential diagnosis based on the case. And the doctor will use this report as a guide for their treatment plan. All the steps are very important. And in modern pathology, we also use genetics, cytogenetics, and also many advanced techniques in order to find out exactly what is going on. What genetic abnormalities is there? What translocation or point mutation or anything like that, we will look for them, because the modern oncology is based on the genetics. It means that the modern treatment options are based on the specific genetic problems. For example, it's breast cancer, and this has this genetic profile. Sometimes it differs from the other breast cancer without that genetic profile. So genetic testing is also an important part that is added to pathology in the recent decade. To summarize, a biopsy sample goes through 7 steps: sample collection, transportation, gross examination, processing and embedding, staining, microscopic examination, and report generation. Every step is critical to ensure your diagnosis is precise. And that's why sometimes it takes too long to get a result. Process takes time until it can be evaluated by pathologists under a microscope. And the world under the microscope is so unlimited. It's very wide. Sometimes a pathologist needs to read many different textbooks and also consult with the colleagues. Ask for IHC, ask for other complementary staining, ask for more medical information, ask from the surgeon, from the medical doctor. Pathology is a teamwork altogether, because this is not just about one organ, it's about the whole body. The whole body, from the skin, from the hair to bone marrow, every part of body. And each part, it has its own morphology, problems, benign and malignant disorders. And sometimes there is a tissue from one side to another side that is completely differentiated, doesn't have the morphology of its origin. And it's not easy to understand what is the origin of this sample. It makes pathology very complicated, but at the same time, beautiful. Thanks for watching. I hope this video helped you understand the journey of your biopsy. I understand that how distressing is waiting for a tissue sample biopsy result. But just be patient, because we need time for precise diagnosis. For more medical insights, please follow me, Dr. Motahare. Stay healthy, stay informed. Thank you.